Hello, everyone. Welcome back to Career Guidance Series US. I hope you're all having a wonderful day today. My name is Ma'in, and I'm one of the coordinators of the Alfaisal MedHub and the International Office at Alfaisal University in Riyadh, Saudi Arabia. It is my honor and pleasure today to be your host. For those of you who don't know what Alfaisal MedHub is, it is basically an initiative under the umbrella of the International Office. It aims to create an online global community of medical students. It also aims to cover a broad range of topics that are of concern to medical students. Our primary objective here is to help students learn more about career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always concerned and confused about the path that is ahead of them, Alfaisal MedHub's Career Guidance series is helping them through this challenge through the perspective of their experienced and successful seniors. As you all are aware, we are now conducting the Career Guidance Series US in partnership with AMBOSS. And today we are excited to bring you a new webinar about the preparing for the Occupational English Test, the OET, for healthcare professionals, which will be given by our accomplished senior, Dr. Muhammad Salik. Dr. Muhammad is a graduate at Alfaisal and has received his diploma in 2021. He is one of the top achievers in the USMLE Step 1 and Step 2 CK exams, as well as having experience in teaching the OET exams for healthcare professionals. Thank you so much, Doctor, for joining us today. It is our honor to have you with us, and we sincerely appreciate the time and effort that you've put into this.
Thank you, Ma'in, for the wonderful introduction. Really a pleasure to be here, honestly. It's an amazing initiative. So a big thank you to, Dr. Ismail Shakir and Alfaisal MedHub and all the wonderful guys working behind it and making it a very, very useful resource for our students. And I hope you guys can benefit and hope everyone's doing well. And if you don't mind, we can get started.
Yes, thank you so much, Doctor. You can start whatever you want. I just wanted to ask you, do you prefer having questions now or towards the end? Like, do you prefer students putting the questions in the chat or towards the end?
Right. So I think it's better to keep it to the end because I think we'll have enough time to cover all the questions. So it doesn't, break the flow. So inshallah, we'll be here, we'll answer all the questions. So I'd appreciate if they can put the questions in the chat while they have them. And then at the end of the session, I'll go through the chat and, answer as many questions as possible.
Okay, sure. So for the audience, feel free to leave your questions in the chat.
Please. Yes, thank you. And can I share my screen now?
Yes.
All right. Can you guys see the screen?
Yes, we can.
Perfect. All right. All right, so as you guys know, today's talk is going to be about preparing for the OET, inshallah. So we'll cover as much as possible and as much as I know, inshallah, I'll try to give you guys everything and hope you guys can benefit. All right, so a quick outline how this talk is going to run. So first, I'll give you guys a quick introduction of the OET exam. How does it work? What are its components? And then I'll take each component and then we'll dive deep into it and see what are the different strategies we can use to, be successful under each category. So listening, reading, writing, and speaking respectively. And then in the end, I'll give you certain links and, additional preparation material for you guys to, practice on, and inshallah, it will be a good one. And then we'll end it with a question answer session. Right. So quick overview of the OET exam. So it's composed of four, as you guys probably know, composed of four different subtests. So you have listening, you have reading, you have writing and speaking. It's basically a one-day exam So you have listening, reading, and writing together in the morning. So it starts around 9 a.m. From 9 to 12, you have these three components. And then you have a lunch break for 1 hour. And then after that, from 1 till 5, you have speaking session. So your time could be from anywhere from 1 to 5. And listening, basically each test lasts for, as you can see, listening is for 45 minutes, reading is for 1 hour, and then writing for 45, and they're back to back. So it's important to keep in mind, they will not give you any additional break time in between. So they run back to back, the first three modules, and then you'll have a lunch break. And now to get the required grade, so we all, at least for the healthcare professional, for the ECFMG and for the GMC UK, the minimum grade required is B grade. B grade is which equals to about 350 on their scale out of 500. And for listening and reading respectively, you have a total of 42 questions. And in order to secure a B grade, you need to at least score 30 out of 42. So you need to score 30 in listening and 30 in reading in total to get the required B grade. And then we'll get into more details later. What are the subtypes? So this is just roughly the figure you need to keep in mind. Of course, this figure can vary depending on the difficulty on the test day. So it can go down to 28, 29, and it can also go up to 31, 32. But 30 is the ballpark figure you need to remember. And for the writing and speaking, as you will see, it's really, it's not an objective test. It's very, very, subjective, and they have their own criteria, as we will discuss. They have certain assessment criteria. Now, OET exam can be taken in 3 different ways. So it could be done at paper, which is, the most common way people do it. And then it can also be done at a computer-based venue, which is also available now in Saudi Arabia. So we have one computer-based testing center in each big city. So we have one in Riyadh, one in Jeddah, and one in Dammam also. And then finally, we have an OET home, which is applicable only to places where they don't have any venue. So it's not applicable here in Saudi Arabia. So we have 2 options to choose from: computer and paper-based exam. Now, the difference is, computer-based exam, the difficulty remains the same. It's the same test. The only big difference is it makes in the writing subtest. So on the paper-based exam, you have to write using a pencil. And for the computer-based exam, you can, type on the computer. So if you can type well, you could also opt for a computer-based exam. So it's basically a prometric center, similar to those who gave their USMLE exam. So you would sit on a computer with in their testing location, and then you will give the exam on the computer. And with regards to speaking, now if it's a paper-based test, the speaking will be done on the same day on the testing center, so in the afternoon, as we discussed. But if it's a computer-based exam, the speaking will be done via Zoom. So it will be done via Zoom. It could be either the same day, it could be next day, or it could be 2 days later. So these are the 2 important differences to keep in mind. One is the writing, which will be typed, and second is the speaking, which will be via Zoom on a computer-based exam. I personally went for the paper-based. Back then, they did not have the computer-based exam. Now let's dive into each individual subtests and then take it one by one. So I'll just put in the order. I'll put it in the order you will encounter them on the exam day. So we'll start with listening, then we'll move on to the rest. Now, listening subtest, this is a quick structure. So it's composed of 3 parts. So you have part A, part B, and part C. Now, one thing to notice, also for the reading test, that the difficulty level increases as you move forward. So the part A will be the easiest, part B will be slightly challenging, part C will be the hardest exam. So that's why one of the the easiest thing you could do to maximize your chances is to really not miss any marks in part A. So you need to really do well on your part A in both listening and reading, as we will see. So part A is basically consultation extracts. So these are basically patient-doctor communication. So patient came in and the doctor is taking basic history and asking him certain questions, and then you need to fill in the question booklet. So it is really straightforward, and the questions are in a fill in the blank type format. Part B is where you have, again, short extracts, but now you have, instead of fill in the blanks here, you will have MCQs. And part C are very long. You'll have 2 long audio, scripts, and you will be listening to them and you'll answer and you will have MCQs on them. Now let's see each individual part. So part A, as I said, so this is how it looks like. So as you can see, you hear a rheumatologist talking to a patient called Harry who's suffering from gout. And it's really, really straightforward. So first they will give you 30 seconds to look at the notes so you can quickly scan the notes, see the big bold picture. So patient name, medical history, and then so on and so forth, maybe past family history, medication. So just organize yourself. And then as you can see within family history, you could, within medical history, it says suffers from gout, has a first attack on holiday, pain in his. So now here you need to basically anticipate. So pain would be usually in his knee or in his toe, in his first joint. So these are the words you will hear for them simultaneously, and then you will write as soon as you hear. Similarly, you can follow the same thing for the rest of them. And they're really, really straightforward. But the only thing is you don't have to miss. So you need to be really in tune. You need to follow what they're saying all the time, because you will only hear the recording once. So if you just miss, like for example, one thing and then if it moves on to the next one, there's no way you can go back. So that's why you need to be really listening, or you need to be really focused and listen all the way through. They're really straightforward, but they can be easily missed. Now there are a total of 2, as I said, 2 recorded extracts, and each extract has 12 points. So you have a total of 24 marks just based on part A. Remember, we needed to get 30 marks to pass. Now, just based on part A, you have 24. So if you can maximize your chance, try to at least aim for 22 plus in this part A. So you will really be set for the rest of the year listening exam. All right. And these are fill in the blanks as we already discussed. Now that's for part A. Now for part B, now this is for part B. Yes, so part B, as you can see, so you'll have short extracts. So you will have, like, you hear a patient talking to a dental receptionist. So they'll give you just brief lead in, and then they will give you a question. So you'll have like 5-10 seconds to read the question, and then they will play the recording. So it's really easy. This is also, there's nothing, difficult about this. It's just 1 MCQ per talk. And you'll hear a short recording, 30 seconds to 1 minute, and it's also really straightforward. And you'll have total of 6 questions like this. So you have 6 marks. So if you can aim to at least score 4 of them correct, you'll already be at 22 plus 4. You'll already have 26 marks by the end of part B. So that will make your life very easy for your part C. Now for part C, it's very long. You have long, recordings, monologues, or interviews, and you have long audio clips, and they are really challenging, because they're challenging in a way because you need to listen and read at the same time, which is really tricky, and you need practice for that, because you are listening to what he's saying, what is his idea, and then you're also reading simultaneously what are the options, and you need to pick while you're listening to him. So that's why this is the part which is challenging, but it needs just a little bit practice and you'll be good to go. Now the trick for this is what you could do is they give you around 90 seconds at the beginning of part C to read through it. So what I used to do is you read the questions and see what the question is trying to ask you. Now here, for example, when discussing patient, doctor suggests that her mother's attitude. So now I'm hearing for basically mother's attitude. So this is a keyword I use to circle or underline or remember that this is what I'm trying to hear. Similarly for the rest of the question. So if you have some central idea you are listening for, that makes it easier instead of, I go back to question, go back to answer. And once the recording reaches this bit, then I know I just need to listen for mother's attitude. And while he's talking, I just quickly scan these options and try to match with whatever is fitting the answer. And of course, during the talk, he will have, phrases which are, out of the topic. So in between 2 questions, he will have certain phrases which are not related to either one of them. So that's where you have the time to disconnect and read the options. So it's basically practice of when to disconnect and when to listen to him. So if you can just practice a few extracts and you'll do 1 or 2 tests, and you will know what exactly they want. So total, you have 2 extracts, and each extract has 6 MCQs, so which gives us a total of 12 marks. And if you even aim to score 6 out of this, you will still pass. It's because you did because you did very well in your part A and B. So if you have 22 in A and 4 in B, that's 26. You only basically need 4 out of 12 in this. So even if you get 50% of these questions wrong, you can still pass your listing subtest, provided that you did very well on your reading parts A and B. All right. All good so far? Any questions?
No, doctor, I don't think there are any questions.
Okay, very good, perfect. So then let's move on to the next one, which is the reading subtest. Similarly, reading, you have same thing. You have parts A, B, and C. Now in the reading subtest, you have 2 separate booklets. So they will give you first a part A booklet, and then they will give you another booklet which has part B and C combined. Now, the problem with reading, the difficult bit is part A is really straightforward, really easy, but the problem is with the time. As you can see, part A, they only give you 15 minutes. And for part B and C, you have 45 minutes. But within this 15 minutes, you need to solve about 20 questions. So you have 20 questions to solve within 15 minutes. That's less than 1 minute per question. So you need to be really fast. Now, part B and C similarly get harder. And C is the hardest, where you have 2 long texts, as we will see. Now let's look at part A. Now, how part A booklets, basically they have a topic. For example, they give you, I just got this from the sample from the website. They give you this was about burns, I think. Yes. So management of burns. So you have 4 small extracts like this. They call it text A, text B, text C, and text D. So each time they'll give you 4 small boxes of text booklet, and within it you'll have this. And then after that, you will have another booklet which will have the questions on which you will write your answers. So you'll have separate booklet. Now the idea here is, if you went on and read all this before going to the question, you will already waste like 4 or 5 minutes. So that's not recommended at all. So the best way to approach this is just look at the bold headings and subheadings. So for example, in text A, you need to at least get what is the main theme of text A. That's it. As soon as I realize what is text A about, that's it. I can come back to it later. So for example, here, if I see burn depth, superficial, full thickness, mixed. So here they're just basically defining different types of burns. So that's it. I don't need to read in the lines. If I just get the idea, I move on. Then I go to the next one. For example, here, what they're trying to say here, text D. Yes, so adult analgesic guidelines. So basically pain control for adult patients. And if you have a table, for example, just quickly look at the table, mild, moderate. So they're dividing different pain scores and then having medication for each. Similarly, at the bottom, you have pediatric analgesic guidelines. So text D basically, I know, is trying to tell me whenever the questions about, pain control in adults or pediatrics, I'll go straight to text D. Now, you just need to spend, I think if you do it like this, you'll spend probably 1 minute, maximum 1 to 2 minutes. You don't have to spend more than that. Just spend 1 to 2 minutes to get the gist of what each text is going to tell us, text A, B, C, and D. And then you move straight to the questions. Now, these are the questions. Now you have 3 different type of questions in part A. First, you have the heading questions. So you have to match the statement. Which text is it going to be? Is this going to be in part A, or is it going to be in B, C, or D? Now, for example, you could see sometimes you have 5, sometimes you have 8. Now here you can see how to categorize the severity of burn. I already know it is going to be in text A. Remember, they had different superficial, full thickness, mixed depth. But still, what I would recommend, or I found it easier, is to skip the headings, because headings, I will go through it anyway. So you will skip the headings and go straight to the fill in the blanks. And then I used to return back to the headings once I finished the rest. So I finished the rest. And then when I came back to the headings, they become really, really easy. So because I already went through the text multiple times because of the other questions. And in the end, this becomes really straightforward. I can probably do it in 1 minute. I can do all 5 questions. So that's one way to do it. So you can play around and see which way suits you the best. Then there are other questions like fill in the blanks. So classification, similarly, whenever you read the question for reading, you need to immediately realize which text is going to be. If you read the question and you don't know which text is going to be, you are lost. Because once you're lost in reading part A, that means time waste. And if you're wasting time, that means you're losing. You will not be able to finish the test. And remember, you have less than 1 minute per question. So that's why your first read is very vital. So you need to really, really know the relationship of what each text contains. Second, whenever you read the question, I should immediately know which paragraph I should go. Like whenever I read, like for example, question 6, classification of burn injuries depends on. Now I'll go straight to text A because that's where I had, superficial, deep. Then once I know which paragraph that is, then it becomes very, very easy for me and I'll save a lot of time. Similarly, I need to use the same technique for, and if you feel that's a question, you feel that you don't know which text is going to be, I would recommend just skip it for now. Because if you waste time, you went to a different text and you try to search for the question and then you move on to you hop onto it becomes really haphazard and you end up wasting more time actually. So just skip it, keep it in mind. Maybe while you're going through other questions, you will find that the question you skipped. So that's why you can leave it for now. It's fine. You can skip 1 or 2 questions if you don't know which text is going to be. And then lastly, you had headings, you had fill in the blanks, and then finally you have short questions from the text. For example, what route should be used to administer ibuprofen to children? So I already know this is going to be in text D, and I know, and it's going to be the bottom half of text D. That's where the pediatric analgesic guidelines are. So I quickly go scan for ibuprofen, and when I see ibuprofen, I just quickly see it's oral. So I just go and write oral. So this text is basically, part A is not about reading. It's about skimming the text, scanning for certain keywords, because if you read, that means you are wasting your time. That's not the way to do part A. If you read the text, and if someone came out and told me that I read all of text A and every single word of it, I can see that was not the efficient way to do it. He probably ended up losing a lot of marks, or he probably ended up not finishing his questions in time. So that's why you need to practice with this, practice with keywords, and quickly go and locate the answers. And also during my prep days, I used to set a timer 1 or 2 minutes short. So I used to give myself like 13 minutes or 12 minutes to solve this. So then I can get fast with timing and improve on my timing. That's why, because part A really, if not for listening, at least for a reading test, it is really make or break. Because reading B and C are really challenging compared to listening B and C, as we will see. So part A can make or break the reading type test. You have 20 questions in 15 minutes, time pressure, as we saw. So first 1 to 2 minutes, skim the headings, just the words, figures, tables, find your way to do it, and find the relationship between the text. What is text A about? What is text B about? Keep the heading questions to the end. I realized this ended up saving me a lot of time. And then read the question keyword, identify the text, skim till you reach the keyword. Go to the text, skim, as I showed you, just go straight to the pediatric analgesic guidelines, and then read slowly to locate the answer. So that's the way to go about part A. Now in this part, it's really, really straightforward. So you should aim to score at least 18 out of 20. So that way you have almost done more than half of the work. So you have got 2/3 of the 30 marks required just by part A. And the higher you score here, the more margin you have to play with later for part B and C. That's about part A. And then once you finish part A, they will take your booklets, and then immediately they'll give you the booklets for part B and part C. Now, part B and C combined, they give you 45 minutes. It looks a lot, but still you need to pace yourself, Now within part B, you will have similar to part listening, you'll have small extracts like this, and then they will give you each extract has an MCQ. So this is very, very straightforward. You have 6 small, basically MCQ type questions. And the keyword is people, end up wasting a lot of time in this part B. So they take like 15-20 minutes just to solve part B slowly. That's not the way to do it. For part B, you need to be fast, maybe spend 90 seconds per question, or even maximum 2 minutes. So you could be finished with these 6 questions in about 10 to 12 minutes, and then you'll have about 35 minutes to spare for your part C. Now within part B, you should target again to get at least 4 out of 6. So you had 18 in part A and you have 4 in part B, which makes it around 22. So you will leave yourself 8 marks to get from part C. Now part C is 2 long extracts. The topics are usually random and usually very challenging, which you have never came across before. And it's usually about, research trial or something new they're trying. So that's why it can get really, really confusing. And that's not the issue, the 2 long text. The issue is with the options. Options can get, very, very close. Sometimes I could narrow it down to 2, but then you cannot differentiate between the 2. It needs, a lot of time. And also remember that you're doing it back to back. So you just finished your listening, you finished, your reading part A and B. So this is it's near the end of 2nd hour. So you really need to squeeze yourself with the part C and just tell yourself this is the last bit and I'm done with this. So part C, you have 2 long extracts and each extract has 8 questions. So you have a total of 16 questions. And remember we had to get at least, so just try to leave yourself as little as possible to get from part C. So if you get like 8 or 10, that's very good score in part C. And the topic, as once you will do the practice test, you will see the topic, the text is too much. You will have, I think, 2 pages of text per extract. You have to go through these extracts and then do 8 questions on top of it in around 15 minutes, which can get very challenging. So again, in this part, the suggested sequence is to start with questions. So start with what question wants. So let's say read the keyword from the question and then go to the text and see and locate what you exactly want, because text has like big paragraphs. So you can quickly skim and locate what the question wants. And then you can read that bit slowly and then come and match the answer. And then you also have a lot of paraphrasing. You won't get the exact words in the text and the questions. And the answers, you will have something similar, but they will paraphrase it, or they will look for something called inference, or they will look for writer's opinion. So they will ask you to read basically between the lines. What is writer trying to get at? He won't get at it directly, but they will ask you, what is he trying to get at? So that's why part C can become challenging for some of the students. And then again, as usual, skip the confusing questions, keep them to the end. You don't have to waste time and your energy on one, twisted question. Just skip it, choose whatever you want for now, because you have about 6, you can make 6 to 8 mistakes in part C. So it's fine, you can miss it, not waste your time, probably do some other easier questions later. So that's for part C. And yes, that's about it for reading. Any questions so far with the reading bit?
That seems good, Doctor.
That's good. All right, then let's move on. Now comes the writing subtest. Now, so far, I think was really not that difficult. It's really straightforward if you can manage a few things. Now, the writing arguably is the most challenging subtest, as usual with, even with IELTS and everything. The trick here with the writing is they have really specific set of criteria that they ask us to follow. And as I'll show you in a minute, that's the only bit. If you just learn what they want and how they want us to write, it can get really, really easy. And you just need to practice. Now let's see what is the structure. So writing is usually, they give you a task to write a letter, and letter is usually a referral letter. Now, For this, you need to understand a bit of how, the healthcare system works, because OET is usually aimed for, Australian and British style. So the healthcare there is, what happens is everyone goes to a GP basically, or a family physician. So everyone's assigned to a family physician. So let's say I have a problem with my thyroid. So my first point of contact will be my GP or my family physician. So I go to his office, I visit him on the outpatient basis, and then he decides whether I need to go to a specialist or not. So if he thinks he can treat me then and there, he can treat. If he decides that I need to go to see a specialist, then this is where the referral letter kicks in. So the GP needs to now write, he will give you an appointment to the specialist, and he needs to write a letter to the specialist detailing what he wants, or basically what he did, what he thinks is going on, and what does he want me to do. So GP, that's where the referral. So referral is basically from GP to various specialties. So they refer to gastro, refer to orthopedics, refer to endocrine. So that's how it goes. And within the referral letter, you will give a bit of background about the patient's history, what are my relevant findings, and what are my plans. I want him to get, for example, I want a surgery to get his tear fixed. He has an ACL tear. I want a surgery. That's why I'm referring him to you. So that's where, the referral letter concept kicks in, and that's what they want us to write. Now that's the majority, 95% of the time you'll have referral letter. Other times you have something called discharge letter. Now what does discharge letter mean? Is basically, in discharge letter is from ER doctor to GP, back to GP. So let's say a patient came to visit us in the ER with stroke, for example. And after you did the basic management of stroke, now I need to refer this patient back to GP for, regular follow-up or medication follow-up. So ER doctor or ER physician or resident, what they do, they write a discharge letter. So within discharge letter, now you know what to expect, what to give. Now within discharge letter, you will not write, for example, patient's past medical history or patients, because the GP knows everything about the patient. So you just write what happened in that visit, and then you give it back. You send the patient back to the GP. So basically, for the GP to know what happened in the ER and what are the management steps the GP needs to take forward. For example, he needs to change the medication dose, or he needs to play around with his, or he needs to keep an eye on certain lab functions. So this is basically the discharge letter. Transfer letter is writing from a resident to a facility. So it could be transferring from this hospital to another tertiary care hospital, or transferring to, for example, a neuro rehab facility, or transferring to a facility which has, cardiac transplant, for example. So that's where the transfer letter kicks in. So that's what they mean by transfer letter. But it will get more clear as we will see in a minute. So task is to write a letter. And the good thing about it is there's nothing you need to write from your head. Everything is given in the questions. So there is something called case notes. So they will supply you with the case documents, which, yes, let's fix this. Yeah, yes. So you have something called case note or case materials. So this is how the writing task looks like. So everything is written. There are case notes which are written. You just need to convert these into a letter format. Now, the trick here is, as you can see, there's too much information here, right? So you need to really know what to pick, what to choose, and then what to send. So the first thing I would suggest is go straight down to the task and see what they want us to do. So first step, quickly read what they want us to do. Using the information in the case notes, write a letter to Miss Graham, an occupation therapist, detailing Mr. Jones' situation and requesting an assessment of workplace. So it's very important. So we are writing, so you know where you're writing. So you're writing to occupational therapists. So specialty is, you have to keep in mind. So with occupational therapists, there will be certain case notes which you can skip, and always whenever you're reading the case note, once you keep the specialty in mind, just ask yourself, what do I want? Like, what does an endocrinologist want? Does he want, his past medical history of 20 years ago? No. So that's why this will help you keep the letter relevant. So first thing, note where you're writing the letter. Then you have to see what you want to do. What's my request? My request is to assess his workplace. So please come and assess the workplace. Okay. And then there's address and everything. So for this, they give you about 45 minutes, but 45 minutes, the first 5 minutes are only reserved for reading. So first 5 minutes, they'll not allow you to touch your pencils. So you just have to have this task, the question booklet, and you have to read. So first 5 minutes, you'll be only reading. So you cannot make any notes, you cannot use your pencils or whatever. Once the 5 minutes are done, then you will have 40 minutes to write your letter. Okay, so so the first 5 minutes are very important. So now I'm already reading in a form of occupational therapist. So I am the occupational therapist and what I want from this. And also sometimes I look at the last bit here. Also, this gives you a hint of, what to do. So again, it says return to work if no lifting, and then letter to OT requesting assessment of workplace, and what else? Advice on duties the patient can. So this can also, confirm and help you just to, reassure you that you know what you need to do and you understood what you wanted to do. Now, as you can see, these are the case notes. So first, these are the patient details, name, date of birth. These we will use later, as I'll show you. You will have to put a RE line. There's something called RE line or reference line of the patient. So we'll use the address from here. We'll use some of the names and stuff. And then you could see a reason for presenting, wants to return to work after back injury. Then you have yeah. So you have some medical history, you have some social background, and then the important thing is here, you could see, is the condition. So first, they will give you multiple visits since you are the GP. So what happens is the patient comes to you over several visits, right? So you have first visit on 31st May, then you have July, then you have August. So you need to keep in mind what is the progression. So he's coming basically every month. So he came in May, then he came 1 or 2 months later in end of July, then he came 1 month later in August. So this gives you how long is this thing going on for. It gives you basically hint of what's to expect. And also you don't have to really put in everything in the letter, just need to pick out the key information. The key information, according to what I did, is it's always in the first visit and the last visit. These are your crucial visit where you need to expand and write a lot. Now, the middle visits, what you need to do in the middle visit is you need to really contract the information. And you would see the visits are usually the same thing. So there was back injury. Then he was recovering on 29th July, he was recovering well, still in pain. Same thing, 30th August, recovering well, still in pain. So within these 2 visits, what you could do is you can just write one sentence of saying, like, over the next 2 visits, patient followed with his physiotherapy and he was recovering, or he was slowly making progress. That's it. You don't need to put in all these details. If you can, try to find 1 or 2 sentences which you can use to fill in all the middle visits. And the first visit and last visit, you can expand a little bit. So these are a few ways and few tricks. And if you can find the structure and how to do it, I think with time, it will get really, really easy. Let's see. Yes. Now, this is how you'll have the blank paper on the exam day. So you'll have a text case notes booklet, which will be separate, and then you'll have blank paper. Now, always there are certain rules you need to follow for writing. So you have name and address at the top. So this you will use from the task here. So you're writing letter to Miss Graham, OT, and all the addresses here, Newton, and all these, just copy paste this address. So you'll put it here. Date, you will use the date which is given, which will be usually the exam day. Greeting will be formal greeting. So it will be Dear Dr. Graham, Dear Miss Graham, right? So that will be the greeting. Now the RE line will be for the patient's information. So you'll take it's regarding or it's in reference to Mr. Barry Jones and his date of birth. So they identify the patient. And then you'll start with your letter. So you'll have introduction, you'll have some middle paragraphs, and then you'll have a conclusion paragraph and an ending. Ending will usually be yours sincerely, right? So this is, let's see one of their sample just to go over some of their things. So these are the sample letter which is provided on the OET website. So as you can see, there's name and address on top, and there's a certain way they need to write address. So just we need to follow them. Then the date, then the greeting, the same thing as we discussed regarding patient's names, patient date of birth, and then you will start your letter. So as you can see, this is his introduction, then there are middle paragraphs, and then he ends with yours sincerely, and just write doctor. That's it. You don't need to write your name or anything. Just say yours sincerely, doctor. Now, to get to this stage, now how will they assess us? So that's very important to know. So they have released something called the writing assessment criteria, as you can see on the slide here. So it has range of different things. So first thing, as you can see, there's purpose, there's content, clarity, and all these things. So what you need to aim is basically we need to get, according to their website, you need to aim at band 5. So you need to be band 5 and above to get the required grade B. Now, to understand these further, what do they mean by purpose? What do they mean by content, clarity, layout? They have released something called OET Writing Guide, which is, I have attached the link on the next slide, where they go in detail of all these, they have a really nice blog post with examples of what do they mean by content, clarity, generous. I would highly recommend you guys go through those, read those, and then start writing your own letters. So yes, so that's why these are some of the useful links for writing. So before you attempt to write your own, first, I think you should read some of their sample letters, see how to do it. And first, once you have a very solid understanding of how to do the letter, then you can, go on and practice on your own. So these are some of the very nice YouTube videos. I really like them. So they have the step-by-step guide of how to do from the official website, and they have some real letters which they will correct in front of you, and they'll tell you what are the weaknesses, what are their strengths. There are some webinars, and this is the OET guide I was talking about. So it explains all the writing assessment criteria thoroughly. So it's a really must to go through this before attempting to write your own letter. And then there are certain YouTube channels which are could be helpful, which are E2 for OET. There's official OET, and there's a guy called Steve. He does writing prep hours, quite often. So these are also good to get an idea what they want. And then finally, the important question is, once you do the letter writing, you need to have someone to look at it. So you can't just write your own letter and then correct it yourself, because then you will never realize what the mistakes you made. So if you knew what the mistakes you had, you will never do them in the first place, right? So always, it's very important to have your letter checked by someone. So it could be, ideally it should be someone, expert with OET. There are some websites like Benchmark, they provide correction services, and then there's Dr. Chi, and then there are all the other OET providers, which they have their own writing correction service. So you could use any of them. Basically, the idea is for you to know you are in the right direction, right? So that's all you need to do. So just have your letters corrected before you go, or maybe even if you're short on time, show it to one of your friends who recently passed the OET, or even you could use the Facebook groups or the Telegram groups to put your letter there and ask for feedback if you're running short on time, just to know that you're in the right direction. Now this is if someone's curious how do they check, this is from the Benchmark website directly. So once you send them the letter, so this is how they correct. They go over the mistakes, they put comments, and then they also give you a report on the side that, if it's too long, if it's too short, and they give you an estimated grade that you would. So this letter was grade C. So it's a good idea to, get your letters checked once or twice. So you are, so you could rest assured that you are on the right track. Now, some other miscellaneous tips. Now, remember, it's a formal letter, so you need to avoid contractions. You cannot use, can't and you will. You cannot use contractions like this. You have to avoid using informal language. You have to avoid using, like don't write shorthands, meds, tell me about. Even, sometimes they give you in the case notes, they will give you blood in the urine, right? So what you could do is, instead of writing blood in the urine, since you're sending to a urologist, just say hematuria instead, right? So you don't need to write blood in the urine. So you can just say hematuria, or if they can give you, for example, his asthma is worsening or his COPD is worsening, what you could do instead, you can just simply say exacerbation. So he had an exacerbation of heart failure, he had an exacerbation of COPD, so on and so forth. So you could use certain medical language, which is formal and it looks nice and it gives you points. Try to use passive voice. Yes, they always recommend using passive voice for formal letters. So instead of saying, I prescribe antibiotics, or I did this, I sent him to the physiotherapist, that's good when we are talking or when we are on the phone. But when we're writing, it's always advisable to use passive voice. So instead of saying, I prescribe antibiotics, you can say antibiotics were prescribed, or a physiotherapy referral was made. So we could avoid the use of personal pronouns such as I. And since it's a pencil-based format, so it's very easy to type on the computer and say that you did good. But it's very, very essential to practice with pencil and paper. We need to go back a bit old school. We need to write on pencil, and it might feel weird in the beginning, but yeah, you need to practice with it. At least write 2-3 letters with pencil, so you get an idea of the timing. Firstly, second, also the word count. We all are so used to using word processor and their word counts. So so you need to know, are you exceeding the word count or you're too short? So there was a trick I used. I just counted the words on average fitting on one line, and then just multiply the number of lines I had. So I depending on the writing, so some write big, some write small. So that gives you a good idea of you are in the right word count figure, which is around 200. You don't want to make it too long or too short. That will also cost you points. So 200 words is the optimum number. So that's for writing. Let's see what else I have. Right, now templates. I get this question asked a lot. Are templates good for writing? Now, the answer is not straightforward. They can be good and they can also be really bad. So I would, firstly, if your English is good, I would suggest not to use them a lot. You can use it maybe just for a few bits like introduction and conclusion, but try to avoid them because, the examiners are so used to these templates. If they realize the students are using templates, they can really severely penalize you for using templates. And sometimes the templates don't always fit on because as you know, the case notes are different, right? So the templates will not always fit on so it's not like one size fits all. So templates are better to be avoided, but maybe if you can use it sparingly, it's fine. But it's better to stay away from it because the examiners will know. Now, introduction, always I use this 3-step introduction, and I also tell others when they come to writing. It's very important. Now, you should always have 3 things within your introductory paragraph. Firstly, you could say, thank you for seeing, or what's your purpose? I am writing to refer. So first, your purpose, I'm writing to refer. Or for example, you're writing to discharge. I'm writing to discharge. First, your purpose should be very clear. Whoever is the name. And then within these 2 commas, I put in his, social history quickly just to plug it in. A 45-year-old school teacher, a 45-year-old accountant. So that's step 1. I'm writing to refer, or thank you for seeing. Second step is, what did the patient have? So now the patient, going back to our patient, the physiotherapy. So you could say, who injured his back during a work, or who had a work-related back injury. Similarly, you could say who has features suggestive of, who has developed, so something along those lines. So second should be, what did the patient have? Third should be what you want the guy to do. So what you want, the one who's reading the letter, what you want to do. So it's either, so for our patient, we would say he requires, he requires a workplace assessment, or can you please, he requires a workplace assessment for return to work, or he requires workplace assessment prior to returning to work. Similarly, you could have, she requires further investigations, including endoscopy, or it could be even surgery, like he requires surgical treatment. So these are the three quick, you should all have these three steps within your introduction to make sure you have a solid opening and you get maximum points with introduction. Similarly, for conclusion, you will have same thing. You could, there are two ways I use. Sometimes I use to conclude quickly after my paragraph. So in conclusion, what happens is, I have noticed some of the students using like templates like in light of the above, or based on the above history and physical examination. Now these words are, all could be avoided. Now whenever you see that there are some words which are extra and they can be avoided, it's better to avoid them. That affects the clarity of your letter. So if you have some words which I can cross out and I can still have the same meaning of the letter, that means that letter is lacking clarity. That means you have added some extra words which are basically fluff. They're not serving any purpose. That's why I advise people to stay away from templates, because templates most of the time give you fluff, which is not really beneficial and you can easily be caught out. So avoid using, in light of the above, or based on the above history and physical examination. So these are extra terms. So I just used to quickly abruptly end like, therefore she's been. Now in the conclusion, basically, as you know, you have to just put your introduction again. So you have to say introduction in a different way. You have to paraphrase introduction in a different way. So you just say, therefore she is being referred to you for operative management, for specialist advice, and then just say, please contact me should you require any further information. That's it. It can be really short and sweet, and it just needs to serve the same purpose of introduction, just rephrase it. Similarly, you could say, I would be grateful if you could further investigate. And these are other terms I just put in. So it's all about vocabulary, right? So if I use, for example, in the introduction, I used for further assessment, or then I could, in the conclusion, I could say further investigation, right? So I avoid repeating myself. So it's good to have, range of vocabulary which you could use, and, instead of repeating yourself, if you repeat yourself, it shows that you have lack of limited vocabulary and limited lexical resources. So you use something like investigate, assess, treat, manage, and then provide a definitive diagnosis. And then similarly, if you require any further information, comma, please do not hesitate to contact me. So these are, I think these were at max the template that I used. Anything beyond that, I felt was a bit too much. So that's my view for the templates on writing. And secondly, yes, discharge and transfer letter. Firstly, it's very, all the rules apply. Everything is the same for discharge, transfer letter. The only thing which changes is the introduction. So instead of saying I'm writing to refer, you just say I'm writing to discharge. And similarly, the follow-up will be, remember the second step was what the patient has. Now in this discharge letter, the follow-up will be what happened to the patient, right? So let's say patient came to our hospital following a fall, or she came following something. So that's what you will write here. So I'm writing to discharge XYZ, who was admitted to our hospital following a fall. And then what third thing was, what do you want from the letter reader? She requires follow-up at your care. That's it. So I'm writing to discharge first. Step 2, what happened? Step 3 was what she needs. She needs follow-up at your care. And then there were some terms which I liked. So you could say stuff like on admission. In a discharge letter, you can use vocabulary which is specific to discharge, like on admission to our hospital, during hospitalization, or post-operatively, this happened. So these are some vocabulary I just collected, which helped me use for discharge letter. Similarly, for transfer letter, the only thing is just the introduction changes. Instead of saying discharge, you say I'm right. Thank you for seeing. Same thing. Step 1 was same thing. Thank you for seeing Mr. XYZ. Step 2, what he has, whose features are suggestive of spinal cord compression. Step 3, what do I want from the reader? He's being transferred to your care, or he's being transferred to your hospital for further management or for definitive treatment. So these are the 3-step introduction, and no need to be afraid of discharge and transfer letter. Even if you get it, it's fine. It's rare to get it, but even if you get one, it's just the terminology which changes. So if you just practice one discharge letter, one transfer letter, you should be good to go. Rest of the letter stays the same. So that's for the writing. I think, yes, that's it. Any questions so far with the writing bit?
Nothing so far about
Doctor, not specifically for the writing, but on estimate, how much time do we need to prepare for the OET exam?
Good question. So the time would vary depending on your baseline English, but I think the ideal time, so some people can take a week, some can take a month, but ideally at least 2 weeks should be given, in my opinion. So you don't want to take it too lightly, have at least 2 weeks of preparation, especially aim your preparation at your weak spots. So first, once I'll come to it in a minute in the end, that once the first step is to see what each section has. Second is to attempt a test. So they have like 3-4 sample tests available on the website. So attempt one and see what you score. So if you're above 30, if you're in the B range for reading and listening, so you don't need to spend so much time on reading and listening. So you can move directly onto writing and specifically spend more time on your weak areas instead of practicing everything together and practicing everything over and over again. I hope that answers the question.
Okay. Yes, thank you so much.
Right, you're welcome. All right, now let's move on to speaking. Now, speaking is really, really straightforward again. I've actually never seen anyone, fail speaking, so that's good news. So speaking is basically a role play. So it's interaction. So you are the doctor, and then the guy in front of you, the interlocutor, is basically acting as a patient. So this is what we do on a daily basis. It's similar to, history taking and, counseling station. So you could say it's a combination of history taking / counseling for the patient. Again, the good thing is there's nothing you need to do from your head, in contrast to IELTS, where you have to bring all your ideas and you have to think on the topic on the spot. But for OET speaking, everything is provided. Similarly, as you saw for writing, everything was provided. Same thing. For speaking, everything is provided, as you can see here. See, this is how a card looks like. So they will give you 2 cards. So there are 2 role plays. So you have 2 cards, and they will first give you 3 minutes to look at the card. They will give you pencils if you want to make notes. And then the interlocutor will start and have, start the recording and have a conversation with you for 5 minutes. So 5 minutes conversation, 3 minutes, around 10 minutes per card, and then 10 minutes for second card. So around 20 minutes, you'll be done with your speaking. Now, before they go on to the cards, there is some, sort of warm-up session where they just speak to you just to get to know you, get to familiarize with each other's accent. That's it, and it's not graded, so you can talk normally and just general questions. Then they will just give you the card, and then they will start a timer for 3 minutes. They will ask you to read the card. So once you get the card, similarly, as you can see, it's very easy. So it's usually has some setting. So you need to note the setting. So you are in the ED. Sometimes it's in the GP clinic, sometimes. So depending on that, you can see. So you're in the ED. A parent presented 2 hours ago at the ED with his or her 4-year-old son. The boy had vomiting, stomach pain, was diagnosed as gastroenteritis. Yes. Now, one keyword here is, remember when we are counseling the patients, we have to avoid using the medical terminology. So instead of saying, maybe you could use gastroenteritis, but better way to say gastroenteritis would be, what do you think?
A stomach bug, maybe?
Excellent, right. So it could be stomach bug or a stomach, stomach upset. So something along those lines would be very, very nice. And if you could do that, examiners would notice that and they will give you more points. Then he was given, whatever fluids, he was observed. And then you told the parent that it's safe to discharge him. The parent seemed anxious. So basically now you need to, calm them down and, use certain words for reassurance. So it's all about, empathy, showing keywords, and, you need to just treat him as a patient and calm him down and just think of it as a counseling session. You should be good to go with the speaking. And all the tasks are given. See, everything is given. Find out about the patient concerns, explain the terms to him. Even the answers are given within the brackets. So you don't need to bring anything from your head. Of course, you can deviate if you want, but I think all the information is provided here. So it's very, very easy. And a small point to note is the introduction is very important. So you could start with something like, hi, I'm the doctor at ED. How can I help you? But something better or a advanced candidate, how would they start is they will use the prompt which is given to them. So as we know here, see, patients are already anxious and you have already told them it's safe to discharge them. So you could use something along those lines and say that, and start the role play like, you could say, hi there, or whatever, greet him. And then you could say something along, I'm sorry to hear about, your son has been suffering from this or has been having a stomach bug. And I can see you are anxious. Can you please tell me more about that? So if you can go like that, and because they gave you the parent seems anxious, right? So if you can lead in with that and start with open-ended questions, that would be really, really good. And it will show that you have good communication skills with the patient. Now, so that's basically about the speaking. Now, there are some key points to keep in mind. So interlocutor is just a role player, so he's not the examiner. So some patients are, some students get, anxiety and stuff, so don't need to worry about. So he's just a role player, he's not an examiner. Unlike IELTS, usually the guy who's taking your English exam, speaking exam, is the examiner, right? So that's why the role players are usually very friendly guys, so you can have very nice conversation with them. And then the session is recorded and it's sent to the OET for grading. Warm-up session, as we discussed, it's not graded. And yes, during your prep time, you'll have pencil and you're allowed to make notes, and you can ask the interlocutor if anything's unclear. You can ask probably his name. So how should I address you? You can ask questions like, what is your name? So you can directly start, hi, Miss XYZ, or hi, Mr. Abdullah. I'm one of the doctors. How can I help you? So that's a good personal touch with the speaking. Avoiding using the medical terminology as we discussed. So instead of saying esophagus, you could say your eating tube, or instead of saying trachea, you could say something like, your breathing pipe or windpipe, abdominal pain, you could say belly pain. And similarly, you could say for other things. So avoid using medical terminology while speaking. What else? Let's see. Yes, empathy. We cannot emphasize much on it. And usually we actually, lose a lot of points on empathy. So you need to be, they will also, you will see within the text, within the card prompts, they will have, underline the words reassure, counsel the patient. So you need to have good empathy. And for that, I have certain phrases, which I'll show you at the end of the talk. Speaking again is assessed based on these criteria, right? So you will have all these different criteria, information gathering, giving. So it's very straightforward. Within each, I found some, yes, these notes, basically. These notes actually go on and explain all the criteria in detail and give you example, right? So build rapport, introduce, be polite, listen actively, that's fine. This is straightforward. And then relationship building, right? How can you, initiate interaction? How can you be respectful? So these are some tips showing empathy. I can see your husband's memory loss has been very difficult for you to cope with. So just some phrases like these, if you can memorize and just practice with your, colleagues or the speaking partner, you should be really good to go. So all these understandings, all of them are really explained under each one of these. So I don't have to, Yeah, I'll probably send you guys or send it to one of the Ma'in or someone, and then he can share the lecture with you guys, where you can read these and make your own notes. So stuff like signposting. So these are the things they're looking for. If you can just, so can I just check that you have understood, or I have understood you, let me know if I have missed something. So these are just phrases you need to incorporate, and you should be good to go. So these are all the notes. Yeah, and then these are some of the phrases for reluctant patient. For example, you can use, certain, you don't have to use all of them. Just go through them, pick the ones you like, and probably just practice with them. It's not like one shot. You cannot practice these a day before the exam. I'd suggest at least have a look at them 2-3 days before, and then, incorporate these. So it looks natural. And instead of, looking artificial and robotic, try to use these also in your day-to-day practice 2 to 3 days before, so that you can, look natural with your, so checking understanding. So these are the phrases like, am I clear so far? How does that sound? So whenever you explain to them something, just pause and go like, do you think you can do that? Do you have any questions so far? Just these small things will give you a few points. And these are all more notes for speaking that I got for you guys. You can go over them if you want. Now for preparation material, what is recommended? First, your first point of contact should be your Oet official website, which has free sample tests, around, I think, 3 to 4 for each subtest, I think, which should be more than enough. I think if you're consistently scoring good in each of them, I think that should be more than enough. You don't need to go to any of the other things which are mentioned below. But if you feel you're struggling, if you find it difficult to get the required band, then you need to go to, the preparation providers. The link is given. So they have many different, companies which help and assist preparing. So you have E2, you have Oet Online, and different companies. And they have also collected 20 prep materials, which you can also have a look in the Oet website, which is linked below. And then finally, shout out to these Facebook, Telegram groups, where you will find loads of experiences. And within file sections, you can actually find some of the materials of, prep materials. It will really help you with your preparation. If you need extra practice on top of the sample test, you can get practice materials, speaking partners, writing correction, and everything. So these are some of the groups that I found, and then I just put them here if you guys wanted to join. Similarly, I think there are loads of other Telegrams groups available, which you can guys find easily. And then there are speaking role play cards. If you need more cards, if you need more practice with speaking, there's a book which is also available within these groups. There's a Futureland book, I think, which has more speaking cards also to help you practice. And some, unfortunately, if they still find it difficult, that means now they need to work on their English. So it's not sometimes not really a quick fix, because it's a language after all. So with language, you need some time and effort and dedication. So I wouldn't recommend, you just keep booking a test after test. No, that doesn't work. And thinking that you might pass the next one, or you might pass the next one. No, if you're struggling, if you're scoring like, if you're on the edge, maybe you can book the next one. But if you're scoring like 300, 310s, that means you need to really work on your English. There's no way you could pass the next one just based on luck. So that's why for those, I just added some more materials for them to practice. For listening, that you have to go through podcasts, so you can listen to them while you're driving, or while you're so these are all the podcasts. Especially I'd recommend the Australian ones, because most of the listening tests are based on Australian accents, so you need to familiarize yourself with Australian accents. So ABC, I think ABC has very good podcasts on health related topics, which you can, and you don't need to passively listen to them. So you need to actually actively ask yourself. You don't need to understand every single word, but at least you need to get the gist. You need to ask yourself, what is the speaker trying to convey? What are his opinions? Do I agree with his opinions? Do I not agree with the opinion? So these are the things you need to actively look at your listening and improve your listening. Similarly, I think, yes, these are the resources, also more resources from the Oet website where you can go on. These are all the resources for extra listening help if you need. For reading, if someone's struggling with reading, I think the best way is to build your vocabulary. If you're struggling with your reading subtest, the number one reason is your vocabulary. That means you have limited vocabulary. So how would you build your vocabulary is by reading more articles. And you can read similarly ABC. Health News has really nice health related articles on new topics, challenging topics. So you can go read the articles, challenge yourself, and make a list of new words you learn daily, and try to make flashcards or try to do it your way so that you can practice and try to utilize those new words in your daily practice so you can increase your vocabulary. For writing, if you're struggling, if you're still finding it difficult, firstly, you have to get the feedback from experts. Even if after that, the big problem with writing now is grammar. That means your grammar is not correct. So where to use the articles, where to use and where to use the, what tenses to use, So for these things, there's a very nice writing grammar book that I found within the links I sent you. So you could go to those links and you can work on the grammar. So I got one of the sample actually from that book. As you can see, it has all the incorrects here on this side and then corrects on this side. So for example, what they're saying here, the definitive article D should be used when referring to body parts. So when we are saying stomach, we must say the in front of it. So these are small things with grammar, which, multiple small mistakes add up and, make you lose a lot of points. So whenever you say, let's say, I suspect adenoma of parotid gland, you cannot say that. You have to say of the parotid gland. Similarly, for names of diseases, you do not have to use an article. So you don't have to say patient is suffering from the high blood pressure. So you have to say the patient is suffering from high blood pressure. So this is just an example of few things from that book to help you with your grammar if you need additional help with the writing, right? So that is for the grammar. And then these are some of the tips that I just collected from the groups quickly. I just copy pasted them over here. Some people, who are really struggling, they gave their own strategies on how to tackle part A, how to score maximum, how to tackle part C similarly. And then for listening, also, I just added in a few more tips for people if you need additional help, you can read through these and maybe see that this can help you with your reading and listening. And that's all I had. And last bit of advice is don't leave it too late. I've seen people leaving it to last few days before the exam and then struggling. So you don't want to do that. It's a big investment, and you need to take it. Even though English is what we do on day-to-day practice, but they have their own set of rules and guidelines that we need to follow and learn. But so if you prep well, 2 weeks, as I said before, I think should be more than enough. And if you prep well, it should be really smooth for you. Inshallah, it should be an easy ride. So thank you guys for listening and participating, and good luck with your exams. And if you have any questions, now we are open to take questions. Let's see. Yes, definitely. I can share my slides. I'll send it to one of the guys at international office, and they can share it to you guys, inshallah.
Okay, thank you for the wonderful presentation, Doctor, and for all the time and effort that you've put into this. We truly value your experience and guidance. I'd also like to thank AMBOSS for their constant support and partnership. And to everyone in the audience, thank you so much for joining us today. We hope that you found this session as informative, as helpful as we did. And if you have any questions, please feel free to put them in the chat, or you can unmute yourself and ask. Also, make sure to follow us on our Instagram and Twitter for the latest updates and events.
Right. Thank you, Ma'in. It's my pleasure. And I have a question from Michelle. So could you clarify which sections we can take notes? Yes. So we can take notes on the speaking. So we can make notes on top of the speaking card, and also on top of the writing, you can make notes on the writing. But keeping in mind the first 5 minutes, they'll not allow you to touch your pencils. First 5 minutes of the writing subtest will only be reading the text, reading the task. And then once you can pick up your pencils, you can make notes on top of the writing booklet as well.
Anyone else has any other questions for Dr. Muhammad?
Yeah. All right. Thank you. Yes, my pleasure.
There's one more in the chat.
Yes. How many days for the results to be out? Like, when is it the safe time to do? Yeah, the result usually takes not more than a month. So it's usually 3 to 4 weeks, and it's actually published on the website. So maybe near the end, the holiday season, it might take a bit longer, but on average, 3 to 4 weeks is really reasonable. So you can plan accordingly, and because you need to keep the match deadline. So I think which is still not released yet, but according to the previous years, the deadline to be done with your requirements is December of the year of the match. So you need to have your OET results by the December of the year, right? So you have 1 full year to prepare.
Okay, if anyone has any further questions or would like to contact us in the future, you can do so in the following link. I'll post it in the chat. And thank you so much, Doctor, for this session. And thank you everyone in the audience once again. We hope to see you again in the future and wishing you all a lovely day ahead.
My pleasure. Thank you, Ma'in.